Hi guys, my name's Ben. I'm one of the PTs here at Fitagain, and I'm just going through a presentation that we did do live, but I've subsequently had quite a few requests to, see this presentation for people that missed it, and so I'm just going to go and talk through weight loss drugs, talk a little bit about what they are, why you might want to use them, and some of the pros and cons. I do just want to start by making it clear this isn't intended as medical advice. Any decision to go on these weight loss drugs should be made with the consultation of a doctor and or a prescribing physician. This is simply, for informational purposes. So I guess I'll start with talking about why we are talking about this. These weight loss drugs have become ubiquitous. They're very easy to get a hold of these days. They're available privately, and the NHS are starting to roll them out to specific patients with specific problems. I think they're looking to prescribe this to more than 4 million people on the NHS over the next 5 years. But also you can get these privately through an online pharmacy and or sort of teledoc. The purpose of this presentation is simply to help you understand what they do, how they work, and how to get the best results from them if you choose to use them. We're not here to promote or discourage their use. We're just here to try and give you all the information so that you can make the best decision for your individual circumstances. So why might someone choose to use these weight loss drugs? Well, I think there's a few reasons. I think people often turn to these because they've struggled with traditional weight loss methods in the past, dieting, increasing their exercise, and perhaps they even had some success in the start, but you've possibly put it back on. The second reason is these weight loss drugs do really help with appetite and cravings, which I'll dive deeper into in a few minutes. And some people may want some help managing these cravings. The third reason is that you may have a weight-related health problem, and this could be something like type 2 diabetes, it might be high cholesterol, it might be high blood pressure, it might be some form of cardiovascular disease, and that you've been prescribed it. You might have been prescribed it by your doctor already. I know there's a few people that have. Again, if you're waiting for this on the NHS, then I think there's going to be very, very variable rollout times for this. And the fourth reason being, you actually just may want to kickstart your weight loss journey whilst also building a long-term sustainable habits, but actually just, you want to see some quick change so that you're motivated to, get started with some sustainable long-term weight loss strategies. So currently, there's 2 sets of eligibility criteria. Okay, so anyone with a BMI over 30 can be prescribed these drugs online by a pharmacy. And then the second category is anybody with a BMI of 27 to 30 who also has a weight-related health problem, like some of the ones that I just listed in the previous slides. So that could be type 2 diabetes. Even pre-diabetes is considered as a weight-related health problem. High blood pressure, high cholesterol, heart disease, that's not, the list isn't limited to those things. There could be any number of things. Someone, when I did this live, actually asked me about what BMI actually means. BMI stands for body mass index. Essentially what it's doing is taking your weight in kilograms and you divide it by your height, and that gives you a score of a normal score would be between 18.5 and 24. That would be what is classed as a normal weight range. 30 and above would then be, 24 to 30 would be overweight, and over 30 would be classed as obese. So anyone that is classed as having obesity by BMI would be able to be prescribed these drugs. And then certain people that are overweight with a health-related problem could also be prescribed them. If you're interested in understanding what your BMI is, you can come and chat to your PT here at Fitagain. We almost certainly have a BMI recording for you, and your PT can chat to you about that if you want to know what your BMI is. So I think it's worth talking about what these drugs actually are, because although they've blown up in the media and everyone's taken them over the last couple of years, they've actually been around for quite a long time. They were originally developed as a medication for type 2 diabetes, with the first one being released in the UK in 2014, I believe. That was called liraglutide. And whilst it was relatively good at managing people's blood glucose, the effects on weight loss were really modest. I think about 5% of body weight loss over the year. So people weren't really looking at it as a weight loss drug back then. And then in 2019, semaglutide was released. It was designed for management of type 2 diabetes and people's blood glucose. This one was released under the brand name Ozempic, which a lot of people have heard of. And what they found was that people with type 2 diabetes that were going on this medication were also losing really quite a lot of weight, which is good for many reasons, which we'll get into later. But it was an incidental finding. And so what they did was then they developed tirzepatide in 2022. That was the third generation of this class of drugs, but it was the first one that was developed specifically with weight loss in mind. And that is currently under the brand name Mounjaro. And then retatrutide is the fourth generation of these class of drugs. It's not released yet. It's in phase 3 clinical trials, but it's showing promising results, and it looks like it's potentially going to be even better for weight loss. So although we've been through 4 different generations, there's only 2 at the moment that's available to buy in the UK. So you've got Wegovy, which is that semaglutide. So it was originally called Ozempic, but because it was prescribed for type 2 diabetes, when they wanted to prescribe it for weight loss, it has to be rebranded to a different name. So it's essentially Wegovy is Ozempic, semaglutide, essentially. And then you've got Mounjaro, which is tirzepatide, so that third generation that's available. Okay, so these are the only 2 that you can buy. If you're looking at anything else with any different name, don't, because it's not. It shouldn't be available for you to buy in the UK. So we'll just talk a bit about mechanisms, because I think it's important that we understand how these drugs actually work. So if you are prescribed it, you'll be given 1 pen for the month with 4 injections in it. The injections are you do yourself, and they're subcutaneous, so that means they're essentially injected into fat. So typically you'll go in your tummy or your leg once per week. So they work by actually mimicking a hormone that's already produced in our bodies in the gut. It's called GLP-1, or glucagon-like peptide 1. So it's released in the gut normally after we eat some food, but obviously we're taking a super physiological dosage of this hormone in order to stimulate a number of different sort of pathways and organs. You can see all the different things that it acts on in this little graphic. But essentially what it boils down to, the sort of the meaningful things that happen when you take this, is it increases insulin production, which is responsible for moving sugar that's in your blood into the muscle in order to kind of storage. So you're taking blood out of glucose out of the blood, which is very good. It reduces glucagon. Again, a glucagon kind of acts as in the opposite way to insulin. So it's making both those things better for a lot of people. It slows gastric emptying, so and also sort of intestinal transit. So your food stays in your stomach for longer, and it also travels through your gastrointestinal tract, your intestines, slower. And the effect mechanically of that is that you will feel full, because, like, I'm sure everybody that's watching this has overindulged in food at some point and felt that incredible bloating feeling that you have when you've shoved too much food into your mouth. And so this kind of mimics that sensation. And then it also reduces your appetite in other ways by acting on different areas of the brain. So the outcome of this is that you have lowered blood glucose, which is brilliant for anyone with prediabetes and diabetes. It mildly increases energy expenditure, and it also increases the sort of breakdown of and use of your fat store. So if you think about, your fat that you have is an energy source. And what it does is it encourages your body to sort of break down this fat to use it as energy, which is obviously how we end up with weight loss. So I think because there's two available, it's probably worth trying to compare and contrast, these two different drugs. Although they are the same class, they do work in slightly different ways, and they do have slightly different results. So I'm just going to go through the differences. So Wegovy, or Ozempic, or semaglutide was originally developed for type 2 diabetes, but was rebranded for weight loss. Mounjaro was that first generation that was developed specifically with weight loss in mind. We have the Wegovy acts on a single pathway, so it only works on that GLP-1, that glucagon-like peptide 1 pathway, whereas Mounjaro actually is GLP-1 but also GIP. I cannot for the life of me remember what GIP stands for, but it's long. But essentially it works on sort of two different pathways, so it's got two different mechanisms that it works by. The dosage range for Wegovy, you start on 0.5, I believe, 0.5 milligrams, and your top dosage will be, after 6 months, will be 2.4 milligrams. The dosage range for Mounjaro is you start on 2.5, and each month you go up by another 2.5 milligrams until you hit 15. Don't get hung up on, more for Mounjaro does not necessarily mean better. They're just two different dosage strategies. So again, this could become out of date very quickly depending on when you watch it, because even in the month between me presenting this to our team and then presenting it to clients, the prices have changed. They've come down. Okay, so this is an ever-changing landscape. So this is just a rough guide. These prices were retrieved from Asda Online Pharmacy in April 2025. So what I've done is, because you start on the smallest dosage, and then over 6 months you work your way up to the highest dosage, where you will stay until, generally speaking, until you've achieved the weight loss that you want to achieve. So as you can see here, up to the first couple of months, the price of each are fairly equivocal. But as you get up to higher dosages, Wegovy does become more expensive than Mounjaro. I've tried to understand why, and from my understanding, there are two different companies, okay, that make these drugs. One is Novo Nordisk, and the other is Eli Lilly, and so obviously they've got different supply chains, and I think essentially, possibly with the American demand, Novo Nordisk supply is limited, and so it's just a supply-demand thing at the moment. But yeah, Mounjaro, if you stick on it for 12 months, is significantly cheaper there, nearly £600 cheaper. In terms of performance, this is data from 72 weeks of use, so essentially a year on the top dosage, after kind of working your way up. Wegovy achieves a very respectable 17% of your body weight loss. So if you weigh 100 kilograms, you would expect to lose 17 kilograms after a year on the top dosage. Mounjaro is 23%, and retatrutide, which is still in phase 3 trial, so not released yet, does even better at 25%. So, I mean, as I said, this is a decision for you to make with your doctor, but from a cost perspective and from a performance perspective, I would be kind of questioning why I wouldn't be going on Mounjaro, because it's cheaper and it is more effective than Wegovy, according to the data. So there's also some starting to be reported some benefits, some health benefits beyond weight loss. One of these benefits is so this was actually done on Wegovy or Ozempic, but this was a big trial where they gave these drugs to people with type 2 diabetes, and they found that compared to groups that just took traditional diabetes medication like metformin or other things like that don't stimulate the weight loss, participants had a 20% reduction in major cardiovascular events during the trial, which is really quite significant. And they also, on average, experienced lower blood pressure, so potentially very good for cardiovascular health. Again, another significant large study found that 10 out of 13 of obesity-related cancers, had a reduction in risk in those that were taking the weight loss drugs. There's also been reports of significantly improving sleep apnea. Sleep apnea is essentially where your airway is obstructed while you're sleeping, and you often experience frequently waking in the night without realizing it. It's truly debilitating health problem if you do have it. But yeah, a lot of people experienced improvements in their sleep apnea. Again, sleep apnea is hugely linked to obesity, and so it appears that there's no separate mechanism other than that the significant weight loss helps with this. Nonetheless, it does seem to help. The other interesting thing that's coming out from the data is that it appears to be useful for substance misuse, so things like alcoholism, nicotine use, and other illicit drug use. And it's thought it does this because it directly acts on the brain and modulates sort of hedonistic pleasure reward pathways in the brain. Often people that struggle with eating as a coping mechanism have reported to me that they just don't feel the need to eat, and it does appear to have carryover into other substances other than food. And I believe in America, they are starting to investigate its use for things like alcoholism, and it seems to be quite effective in early trials. So it all sounds really quite good at the moment. So let's talk about some of the risks, because there are some. Okay, really common, not too big of a problem, but it's a very frequent side effect. Is up to 50% of users will experience GI symptoms, so gastrointestinal symptoms, and this will be largely diarrhea and constipation. Sometimes vomiting. I've not had any clients report to me about vomiting, but certainly diarrhea and constipation is frequently reported. It is often worst when you start these drugs, but that's why you titrate up slowly to the highest dosage. And I think by the time you're at month 6, 80% of GI symptoms have disappeared. So it does get a lot better as you get used to it. But in the start, you will possibly experience GI symptoms. Much less frequently reported, but like with any medication, there are some rare side effects. You may get fever, you may get an allergic reaction to it, you may feel dizzy, and in some cases there's been reports of hypoglycemia, so sort of low blood sugar. But these are I think 1% or less. They are rare side effects, but side effects that you should just be wary of in case you are one of those people that does have a reaction. For a couple of years ago, I think there were some early concerns about its risk of thyroid cancer. These have largely been put to bed, so that it was data from rat studies to start with, and then they have done a recent pretty large systematic review. For anyone that's sort of not familiar, that's the highest tier of and quality of sort of scientific research that we can produce at the moment. So it's very rigorous, and they've not been able to find any evidence of increased risk of thyroid cancer so far. Again, that study was only conducted over 2 years, but I think for them to confidently say there is no evidence at all is positive. Of course, if you are concerned about this, it just may be something that you want to chat about with your doctor, because ultimately we are still in relatively early days of these drugs being prescribed. Another sort of anecdotal reports, but there's been a few physicians voicing their concerns about it, but I think there's been the odd report of suicidal ideation, so suicidal thoughts or self-harming behavior of people whilst on these drugs. Again, there's been a pretty big review done of this and not found any link on average, but that doesn't mean that individual risk doesn't exist for certain people. I think if you've got a history of mental health problems, then it is certainly worth chatting to your doctor about this before you go on these drugs. So just to summarize all of that, these drugs have been studied extensively, lots of large systematic reviews, and I think if anything had been found that was significant or life-threatening, they would have been teased out by the data by now. But that doesn't mean that smaller risks won't become apparent over time. If you take the example of statins, when they were first released, it was immediately obvious that 5 to 10% of people that take statins would get muscle soreness. That was an obvious immediate effect. But then as we studied these drugs more over time, they were actually able to find that there was a small subset of people that take the drugs that were more likely to develop type 2 diabetes if they were on statins. And so essentially that's what you might find with these, is that although there's nothing nasty immediately obvious, that it doesn't mean that something smaller, but that you might want to consider, does get teased out of the data. But we've got people, there's data showing people being on these drugs for 4 years, 4 years without stopping, and no significant harm done so far. So it sounds pretty good, doesn't it? We could look at up to 25% weight loss after being on the drugs for 1 year at the top dose. There's a bunch of other health benefits that are probably just secondary to the weight loss, but hugely important. Reducing your risk of heart problems and cancer and diabetes and improving your sleep are all amazing things to have as a benefit. And really, the side effects for most people are quite mild. So what are our concerns from a gym perspective? So they're muscle loss and weight regain after stopping. So we're just going to talk about why we care about that and why you should care about it too. So this is a chart of somebody that has been on the weight loss drugs for 4 years. This one was Ozempic or Wegovy. The blue line is the group that took the drugs, and the sort of grayed out top line is the people that went on a placebo. The y-axis is showing how much weight they lost, and the x-axis is showing the amount of weeks. So as you can see, the placebo group kind of stayed where they were, as you would expect, and the people that took the weight loss drugs experienced a pretty rapid decline in their weight over the first 6 months as they titrated up to their top dosage. And then once they were on that top dosage and they stayed on it, their weight kind of plateaued out at a nice, 10% or so weight loss. And so it looks like that if you stay on these drugs, essentially you will lose weight and you will keep the weight off. But what if you stop taking it? So it's a bit of a messy graph, but essentially the coloured lines are people that took varying dosages of Mounjaro or one of the weight loss drugs, and the top line is those that took a placebo. And so if you see along the bottom, at 52 weeks or a year, that's when the participants stop taking the drugs. So what it shows is that once people stop taking these drugs, after 2 years, then most people had put pretty much all the weight back on, so that they had basically started at about 2 kilograms less, which isn't ideal. And it didn't appear to matter how much weight you lost or what kind of dosage you went on. You just put the weight back on quicker. Obviously, we don't think this needs to be for everybody. Otherwise, I don't think anyone would be taking these drugs. But that's just what happened when they followed some people that took the drugs. Okay. So the other big problem is muscle loss. So I did this live, but if you want to pause the presentation now to try and work out for yourself what's wrong with it, go ahead and pause it. Otherwise, I'm just going to continue and explain. So on the left-hand side is somebody that took, it's their body composition before they started the drugs and then after they took the drugs. So you can see before they started the drugs, they had 48.2% body fat and they had around 52% muscle mass or lean mass. And after taking the drugs, it looks pretty good. They're now 40% body fat and they're now 59% muscle mass. So while the relative change is good, the problem is the absolute change was this. So they lost 23 kilograms of body weight after being on it for a year. So in line with what the data is suggesting is that you can lose about that 23% of your body weight. And they lost 17 kilograms of fat, which is excellent, but they did lose 6 kilograms of muscle. So what's wrong with that? So muscle mass is important for a number of reasons, okay? I think if you're, particularly if you're getting older, it's really important that you maintain muscle mass. It's really hard, or gets exponentially harder to put muscle on as you get older. And so maintaining it is extremely important. If you don't have muscle mass, then, you become frail, your risk of falling increases. Declining muscle mass is associated with, increasingly poorer health. So it's extremely important for a number of reasons. And if you lose 6 kilograms of muscle, that would be like 6 years of age-related sarcopenia. So on average, we lose about 1% of our muscle mass per year as we get older. And this is essentially like accelerating your age by 6 years, except it's only a year. Also, muscle is metabolically active. It's a very metabolically active organ. And if you were to lose 6 kilograms of muscle, that would cost you around 100 calories per day that you're not burning because you don't have that muscle. And although that doesn't sound like a lot, that's a Kit Kat, okay? But over the course of a year, that cost that you can't have would add up to 35,000 calories, or in other words, around 5 kilograms of fat of energy. So that's how much, that's quite a significant amount of weight that you could just afford to not put on by maintaining muscle mass. So and this, to be honest, was favorable results, which I'm about to dive into, but only losing 6 kilograms of muscle. So only about 25% of your weight loss in this study was from muscle, which is really quite good, because the data is actually showing it's probably worse than this for a lot of people that take the drugs. So the green line is so this is your body weight loss along the bottom, and then your muscle loss, your percentage of your muscle loss along the top. So the best if you do sort of a side-by-side comparison of diet, of gastric band surgery, and then the weight loss drugs. Obviously, diet was best for preserving muscle while losing weight. It was about 25% muscle loss or like 1 kilogram of muscle for every 3 or 4 of total body weight loss. But these weight loss drugs were up there with gastric band surgery in terms of how much muscle you lost as a proportion of your total weight loss. So it's kind of showing that anywhere between 35 and 50% of your total weight loss could be muscle mass. And if you're losing 23 kilograms of weight, that's 12.5 kilograms of muscle potentially that some people are losing, which is just, I don't think that's okay, basically. And I think a lot of people would agree that that's not okay. However, obviously, we wouldn't be doing this presentation or showing this data unless we thought we could do better than that. You don't have to be another statistic. I think it's worth remembering that a lot of the people that do choose to go on these drugs or went on these drugs early, were viewing them as a bit of a cure or a miracle drug. That's not the case. They're incredibly powerful tools, but ultimately, if you want to keep the weight off after you stop, then you need to make some long-term behavioral changes. And also, you need to put the work in to preserve your muscle mass as best you can when you lose the weight. So I did a little bit of digging around before we started taking on clients with us. I did a bit of digging around the research to see, is it actually possible to preserve muscle while losing weight? And it turns out it is. So there's no studies that have been done specifically on the weight loss drugs yet for this. I would really like to see some. But what I did do was find a systematic review of older obese adults that went on a diet. And as you can see, one group either did the diet and some resistance training, that you like you would do in here at Fitagain, and some went just on the diet alone. And what you can see is they both had quite comparable weight loss overall. But what you can see is, whilst the group that didn't do the resistance training lost about nearly a kilogram of muscle in the process, the group that did resistance training were actually able to maintain their muscle mass and even put a tiny bit on. So essentially what this is showing is that it is within the realms of possibility to lose weight and maintain muscle mass. The other thing that we need to consider is, firstly, you have to do the resistance training so that you can break down your muscles and so that they can, they're being stimulated to grow or at least stay the same size. But you also need to make sure that you're fueling your muscles with the right things so that they can actually be maintained as well. And to do that, you need to focus on protein. Protein alone is responsible for, making sure that you maintain your muscle mass. So I looked at how much do we need here to be able to sustain our muscle mass, and the answer is it's quite a lot, more than most people are taking at the moment. So this study found that if you are under 1 gram per kilo of body weight per day, that you were probably not going to be able to maintain your muscle mass. But up around 1.3 grams per kilogram of body weight per day, you could preserve or even put muscle on during weight loss. From personal experience, I think you really need to be up around 1.6 to really make sure. That is hard. I'll explain in the next slide here what these mean, because obviously you're probably scratching your head thinking, what on earth does 1.3 grams per kilogram of body weight per day mean? What's that actually mean in real life? So let me show you. So I put this little table together. So I've taken 2 different people just because we're going to have a variety of people on different weights here. So I've taken an 80 kilogram person, or essentially, if you're using old money still, 12.5 stone, and then a 100 kilogram person, or someone that's a smidge under 16 stone here. And so I've taken those minimum ranges. I've said we need to be hitting a minimum of 1.3 grams per kilogram of body weight per day, and really aiming up towards 2 grams per kilogram of body weight per day. So I've given you the reference ranges that you would have to eat. And I've taken some major protein sources that you would get from your diet, and I've kind of totted up what that would actually look like. So you can pause the video here and have a look, but it's really quite a lot. Obviously, I'm not suggesting that you eat 4 sirloin steaks per day. You would obviously have a variety of different protein sources from your 3 meals a day. You might have some eggs in the morning, or a bit of smoked salmon. You might have some chicken and some red meat or something like that for dinner. You obviously could have lentils in there somewhere, and possibly a protein shake or some kind of protein yogurt or protein sort of fortified sources, of which there are many these days, in and around your workout. If this is looking like you're way under here and you're considering going on these weight loss drugs, I strongly encourage you to talk to your trainer at Fitagain, because they will be able to help you optimize your nutrition. Ultimately, there's no point putting all the hard work in the gym to preserve your muscle mass if you're then not making sure that you get your protein intake and you're not able to build back, your muscles. Okay, so it's really important that you're fueling correctly as well. Both of these things need to be addressed properly. So I'm just going to take a bit of a case study. This is one of our clients that we've been working with over the last 8 or 9 weeks now. Obviously, data's anonymized, but she's happy for us to share her journey, and it's a really positive one so far. Okay, so she's 56. She had a BMI of 29 and had high cholesterol when she was prescribed the drugs. So she fit into that second category of being between 27 and 30 on her BMI, but because she had high cholesterol, she was able to be prescribed it. She'd had multiple periods of attempts at weight loss, and I made some decent progress when she'd done it with traditional sort of dieting, and she has exercised a lot over the last few years, but has just seen sort of the weight rebound after putting in a lot of effort. So she had a chat with her GP, and GP said it was probably fine for her to go on Mounjaro, so she decided to pull the trigger and go ahead with it. So what we did first was, and this is how we can help you here, is that I think it's really useful to actually understand what you think your end goal is here. You go on the drugs, but what are you going to be happy with? There's a lot of things to consider, but we decided that the first goal would be to lose 16 kilograms of body weight. So that's about 19% of her starting body weight, and that would put her BMI into the top of the normal range. So this seemed like a realistic and achievable goal for us to aim for. And she also agreed that she would like to preserve as much of her muscle mass as possible. So what I did was I sat down and created a sort of a resistance training program for her that was, geared up for preserving muscle as much as possible. So it's quite hard, it's 3 sessions a week, and essentially we're just attacking all the muscles as hard as we can during those sessions. And she worked really, really hard on those. But yeah, it's they're tricky sessions. And so we also looked at her nutrition. I had a look. So she's been really good about it. She's using MyFitnessPal or one of those macro tracking apps to log all the food that she's eating. She weighs it out, or she scans the barcode so that she knows exactly how many calories she's getting, how much protein, how much fat, how much carbohydrate she's also getting per day. And we did some tweaking of her diet so that she was making sure that she's above that 1.3 gram per kilogram threshold for her protein intake. So we sat down and worked through that together. And like I said, she's been tracking exactly what's going in, and she's also regularly weighing herself so that we know that we're going in the right direction. So this was her, and you guys are probably familiar with this chart. Okay, this is on our software. This tracks body weight on the top, and then on the bottom is muscle mass. Just because of the scale, the muscle mass chart looks terrible. It's not that bad. I think it's 48.5 to 51 kilos. So she's plus or minus 2 to 3 kilos. And this is over the last 3 years or so. So as you can see, she's kind of just been floating around in this 84 to 88 kind of kilo body weight, where she's had some really nice steady weight loss, possibly not as fast as she would have liked, but then has had sort of relapses where she's put it back on for various reasons that she's cited. Okay, so her starting weight was 86 kilos, starting muscle mass was 49.5, and what we got to so far, so she's now 8 weeks. She's now 8 weeks in, so she has actually lost even more, because I think she's now down to 79 kilos. So she's lost another kilo of body weight. So anyway, but at the time of writing this, she'd lost 5.5 kilos in 6 weeks, which is at the top end of how quickly we'd like to lose it. We don't really want to lose more than a kilo a week in order to preserve muscle mass as best we can. But she's lost 6.5% of her body weight already. And she's only had a negligible amount of muscle loss so far. And actually the percentage of her weight loss that has come from muscle, bearing in mind that the data is suggesting it should be 33 to 50%, is we've got it at 14% at the moment. So hugely better than what the data is suggesting. So we're really, really pleased with that so far. And she's still got, a long way to go if she wants with these drugs, but it's a cracking effort. In terms of her training, we aimed to do 3 full body training sessions per week. And what ended up happening was that she's averaged about 2 per week. She got really quite ill. She's had, real life stuff getting in the way. So it's not been feasible. But so on average, apologies, I know you probably can't see that very well, but she's averaged 2 sessions a week. And despite this, we've still managed to keep the muscle loss really low. So we're not even fully optimized, and she's still having very, very good results. And she's, I think, overall pleased. She's starting to see the difference in the way that she looks and feels, and she's really quite motivated to carry on. I think it's really worth pointing out that she's also, whilst being on these drugs, she's really put in a lot of effort into her training and her nutrition. And so I think she's really setting herself up for the best chance of being able to maintain her weight loss when she does reach her weight loss goals. And I really want to underline the importance of that. You have to have the mindset of, I'm going to make some big life changes, so that when I do come off these drugs, I'm prepared and I'm able to, enjoy the benefits of all the hard work and that I've done and the money I've spent. So just to conclude, okay, so these drugs are incredible tools. Okay, they're brilliant. I think they're here to stay, and they're probably going to get cheaper and cheaper, and they're going to be amazing tools, but they are not a quick fix. Okay, you will have to probably come off these at some point, and when you do, you need to make sure that you have strategies in place so that you stay this healthy weight that you've achieved. Okay, we recommend that you carefully consider all the risks and benefits with a medical professional before going on these drugs. So speak to your GP, speak to your online prescriber to make sure that it's the right decision for you. But if you do go ahead, we are here to support you. And I think also, we can help you get the best out of it, your money's worth out of it, the best results, and we can also help you keep the weight off. So that's how we can help you. Obviously, I can't take any questions because it's recorded. But if you do have any questions, you can pop them to any of the trainers here, and they'll be happy to answer them further. I really hope that you found this useful. Apologies, it went on a bit longer than I thought it would. Yeah,